Hello, good morning everyone. I'm Dr. Swarupa here once again. I'm from Rajiv Gandhi Cancer Institute. I'm a cancer specialist, but today I'll be talking about something which is very close to anybody's heart, especially women, and an issue which is very important in lives of every woman. So that is the bone health in women. This is the topic of discussion today. Now, why is it important? Why are we thinking and talking of bones? Because first of all, bones are the structural units of our body. It is the bone which makes our skeleton. It gives us stability. It gives us the integrity. It protects the organs inside us. And it also gives us the confidence to do our work every day. So that is why the health of the bone is very, very vital to our existence. Now what happens? We are not aware, we do not know that the bone health is so important. This is because we don't talk about it. We are not aware about it. We do not know. We are aware about it only when something happens to us. So that is why this is an issue which needs to be discussed and which is usually not discussed. Now let me first talk to you about what happens. What are the bone issues in bone health? So one is very important, is the osteoporosis, and the other is any kind of weakening of the bones or any degenerative diseases. The important ones and the common one are the osteoporosis. What is osteoporosis? Osteoporosis in simple terms is just thinning of bones. It is the thinning of the bones become weak and the bones become brittle and they become very, very liable to fracture. And this happens very silently within our body without our knowledge, and we come to know only all of a sudden when a fracture happens. So what do we do about it? So we need to understand the mechanism of the physiology of the bones. What is bone made up of? The bone is a solid unit. It is made up of proteins and it is made up of several other minerals, out of which calcium is most important. So the physiology of the calcium in the body is very important for us. What happens? Calcium is the main component of the bones. But at the same time, calcium also is an important component of the blood. Now, blood is very selfish. What happens if the calcium level in the blood decreases? It does not suffer. It takes away the calcium from the bones. So, in this way, the bone calcium is depleted and the bone becomes weak. If this calcium level keeps on being maintained at a low level in the blood, it keeps on drawing that calcium from the bones, all bones of the body. And this is how the bones become very weak, depleted of the calcium, and they become very brittle and friable. So we can understand the calcium level low in the blood, that is the crux of the disease or the status, which I might say. The other factor is that, which is pertaining to women especially, is the menopausal status. Menopausal women are more liable to get osteoporosis and later on fractures and stretch fractures as well. How does a bone grow? Now from the utero, we know the children and they have bones, and these bones keep on developing, keep on growing till the age of about 16 or 17 years old. Then after that it reaches its maximum density or maximum strength when the woman is about 30 years old. And after that the bone starts getting weaker. This is a normal physiological cycle. So this is the time, that is after about 30 years of age, we need to be careful about our bones. So what are the symptoms of osteoporosis? Osteoporosis unfortunately is silent. It has no symptoms at all. In fact, as women, we don't even understand, we don't even feel that there is something happening in our body and our bone is getting weaker day by day. We come to know only when a fracture strikes. And let me tell you, this fracture can be absolutely unprovoked. This fracture can come up only even with the smallest activity, even like a sneezing. A bone can get fractured. So this is not at all to scare all of you. This is just to make all of you aware that this is what happens in the body, and when we have time, we should be very, very careful about it, and we should try to prevent it. And that is why the symptoms are important, and that is why we must try to understand what the symptoms are. Second most important fact is that how do we prevent? We need to, this is a condition which can be prevented, very well prevented. So what can we do? The first and foremost is, of course, is the diet. We have to take care of our diet. And the diet, what are the sources? The sources of calcium are mainly the leafy green vegetables. All green vegetables are the broccoli, the spinaches, the turnips. These are all green vegetables which are very, very rich in calcium. The other sources are juice. Orange juice is a very important source of calcium. All milk products, they are dairy products. In fact, I should say the dairy products, they are the most important source of calcium. We should not forget about vitamin D. Calcium is an important component of the bone, so are many other materials like the phosphorus, the vitamin D and the vitamin A. So vitamin D is a very, very important source that actually strengthens our bone. And it's very simple as that. That vitamin D source, the most important source is the sunlight. So we need to expose ourselves to the sunlight sometimes during the day. The other sources of vitamin D are again eggs, then salmon, fish, mackerel and mushroom for those who are non-veg, for veg. So these are the important sources of vitamin D, and we should try to incorporate them in our diet as much as possible. The other thing very important is the exercise. Inactivity, which we have, our style of working, our lifestyle, these are very inactive. We are not doing actually anything. We sit at our desk and work. So this is a very, very important predisposing factor of getting osteoporosis. So we have to incorporate some regular exercises in our body. Now, what kind of an exercise? Basically, these could be something like weight training. They could be something like balance training, walking. So these are important exercise patterns which help us in preventing osteoporosis. Now you might ask me, what should be the exercise routine? Should we do it daily? And if we do it daily, then how much? How long should we do it? This is something very, very important. Most of us, we do not know how much exercise should be incorporated in our daily routine. So the studies say that about 45 to 60 minutes of exercise, not daily, you don't need to do it daily, but about 3 or 4 days in a week is sufficient to prevent an osteoporosis. So important factors are your diet and exercise. These are important things. Others are, of course, we have to curtail drinks from our diet, smoking, so these should be avoided as far as possible. Now, other than these, we need to know that what do we do? How do we, what should I say, that how do we take care of it? Is there anything which we can understand, which we can do, that we can know that this is how the osteoporosis is happening in our body? Yes, there is something called as a bone densitometry. Like I said, till the age of 35 years, the bone becomes the densest. But after that, gradually the bone density starts decreasing. So there is something called a test, I would say, which is called a bone densitometry, or it is called a bone DEXA scan, which should be done. And this is a method which is a test which can be done in our body. It is a simple test and which is available in probably every laboratory or a radiodiagnostic center. And this scans our body and sees how brittle or how strong our bone is. So if we come to know about this, then we can take care. Suppose we know that our bone density is less, so we can take care of it. We can go to a doctor and prescribe ourselves with adequate dose of vitamins or calcium, so that we don't need to face the outcomes of osteoporosis. So I would recommend, in fact everybody recommends, a bone densitometry should be done for all women who are more than 50 years of age. So let us all incorporate this in our system, in our daily routine, that our bone densitometry should be done. I always prescribe to everybody that let us do it on our birthday so we don't forget it. Every woman on her birthday should do a cancer awareness, should do a bone densitometry. So it becomes and this is probably the best gift one can offer to oneself. And because the gift is life, is nothing better than life is the best gift. So this is the best gift we can offer ourselves. So every woman should subscribe themselves to a yearly bone densitometry or DEXA scan. So this is way we can prevent osteoporosis from happening in our body. The other common things that can happen with bone is degenerative diseases. Degenerative disease is actually not a condition, it is a disease, many people say. But this is physiological once again. Degeneration, this happens mostly with the cartilages or the ends of the bones and the joints. Like the knee joint or the elbow joint or other joints, they get eroded with age and they get eroded with our daily activities. And then one fine day it starts paining and the pain becomes so severe that it may incapacitate us. So these are the bone degenerative conditions. It happens more with the runners and athletes, and more so with women. So if anybody is a regular athlete, a regular runner, so that person should be more careful about the degenerative changes happening in her body. And again, menopausal, that is also a factor. Menopausal status, that is also a factor which causes these degenerative changes to happen earlier in the body. And what are the other factors which are predisposing to these degenerative changes? Age, of course, and the sex. Like women, they are more amenable to all these bone health, bone related diseases or conditions. And the other factors are a family history. There may be a family history of getting osteoporosis or degenerative symptoms earlier. So for these patients, it can happen earlier than a normal woman would have. The others are, of course, ailments, your nutritional status, immunity status, your daily activity or inactivity, obesity, hormones. There are several factors which can predispose to these conditions. We are not capable of controlling all these factors, but at least some of them we can control. So we can incorporate the diet and the exercise in our daily activities, in our daily routines, and this is going to prevent us from developing any osteoporosis, and we can keep our life as healthy and active as possible till the last day. And once again, before I end, I would like to request everyone, all women, to get a bone densitometry done once a year, definitely and regularly. Make this a religious practice. Thank you so much.